Welcome to Unmask Health. This is the first episode. I'm going to try to release 3 episodes this week back to back so that y'all have something to watch and it will be interesting maybe. But today we're going to talk about exactly what testosterone is and how much of it a man really needs. So what is testosterone, first of all? And some of y'all probably already know, so don't get offended if you already know and whatever. But it's just a steroid hormone that's mainly produced in your testicles. But anyway, it starts before you're born. It starts, in the womb, and then it peaks at puberty, and then it starts to decrease around the age of 20 and 30, and then it goes down about 1% after the age of 30. You should have normal is that you will have a gradual decline in your testosterone, but if you suddenly have a severe decline, like a sudden drop in it, then that's a problem and you need to go see your doctor. And most men, I'm talking to you men, y'all don't want to go nowhere until y'all are just bad, till it's real bad. These symptoms, y'all have to be about dying before you go anywhere. So we're trying to change that culture, that the generational thought that you can't be a strong person or a strong male if you go to the doctor, because you very well could be. You have a lot to offer, but you have to be healthy. And there's no reason why y'all can't be going to providers like me, but not specifically me. I'm probably far away from you. But anyway, let me get back to this. So testosterone, I'm sorry, I'm trying to make cucumber salad, but testosterone doesn't just make you a man. Like, you have other things that make you who you are. But testosterone will impact your brain. We know it affects the muscles, of course, because we know people used to illegally use it. But it will affect your sleep pattern and it will affect your mood. A lot of men, when they come into my clinic, they talk about how tired they are, how fatigued they are, and how sometimes they're just having mood problems. Like, they're either really depressed or they're really angry. One of the two. They're either one spectrum or the other. Anyway, the normal testosterone for a male, and I know that there's probably going to be some kickback on this, but hopefully not. But normal is 300 to 1,000. Now, when I'm treating a male, I like for his testosterone to be 800 to 1,000. Anything higher, I don't consider that to be safe. Anything below 500, I think that males, especially the older you are, you can really feel your symptoms. So, when you get ready to go have like lab strong, you find a provider that you trust, that you like, that you can go in and say, hey, something's wrong. Like, I don't feel good. I can't have sex. I can't perform. My head's foggy. I'm sad. I'm depressed, whatever. We'll talk a little bit about that. But when you go, then they will know, hopefully, what labs to draw. Normally, what we get is a free and total testosterone, because your free does matter with your total. And then, you want to get like your estrogen, estradiol. That's just one that I draw as a baseline, a CBC, a CMP, and for sure a PSA, which is a prostate screening test, blood test. But some of the side effects or some of the symptoms of low testosterone we kind of highlighted on, but one of the ones that affect the men the most is a low sex drive. So if I have somebody come in and they're like, hey, I want some Viagra or Cialis, and I'm like, hey, let's check your testosterone first, because you're at the right age where testosterone will be going down. So, and that's a fix. We could, there's different ways to get treatment for low testosterone. Weekly injections is one, but not everybody's going to have to be treated for their testosterone. It just depends really what's going on with the patient and what the provider thinks, and what you as a patient, as a man, are willing to do. There's topical therapy. There's, pellets that you can have inserted like under the muscle in like your hip area, and it's changed about every 3 to 4 months, maybe less than that, depending on where you go. But it doesn't mean that you always need a shot, but it doesn't mean that it's all in your head either. So you need to know your numbers and what they mean. So normally we do the blood test. We do it before 10 o'clock in the morning. preferably fasting in case we need to check some other labs on you. And there's just different, every lab has different ranges. And so you can't just Google normal testosterone or normal estradiol or normal PSA or normal whatever, because everybody's labs, they run a different range. So make sure when you go and see somebody that you talk to them about that also. But more importantly, if you've been somewhere, because it takes a man a lot to go somewhere, finally take time off work, right? Because y'all are taught you got to work, you got to be the breadwinner. You know, maybe you're too prideful to go to the doctor. Maybe you don't want to admit that you have something wrong and that you can't get, an erection like you're supposed to or normally have. But if you've been told that you've been fine, but you still feel off, you don't just stop at one provider, okay? You need to keep going until you find somebody that will listen to you. There are a lot of providers out there that spend the time with the patients and they actually listen to them. But you just have to find the right one. You have to advocate for yourself, pretty strong. And the woman in your life or whoever's in your life, can advocate for you, because sometimes having two is in a room is more powerful than just having one. So don't feel like you're just going to be dismissed by everybody, because I know, dealing with men in my health, in my practice, and the healthcare world for the last a little over 20 years, if you have somebody that tells you, well, there's nothing wrong, then you are basically done. You're just like, okay, well, I'm not going back. But testosterone is very powerful, and it's key to who you are as a man. It balances who you are as a man. It's not just boosting who you are, but it balances you as a male. And so next week, what we're going to talk about, or the next episode that I'm going to talk about, is going to be what causes low testosterone. And are there ways to fix it, holistically, naturally, that kind of stuff. But we'll talk about that. But today, I just wanted to kind of touch base with what testosterone really is and what your numbers should look like. And just know that you should get it drawn before 10 o'clock in the morning. There are some places that will draw it at 2:30 in the afternoon. That's not an accurate picture of who you are. So thanks for unmasking testosterone with me today. Share it with anybody that you think needs to hear it. Listen to it again if you want to. And you can email me with any questions or comments that you would like me to address it before the next episode comes out. And make sure you subscribe and follow so that you can listen to Unmasked Health every week or twice a week or 3 times a week. Right now it's going to be weekly, but we'll see how it goes. I'm new. I'm just launching. So we're going to dig into the real causes of low testosterone on the next episode and why it's not just about how old you are. Okay? Have a good day. Bye.